Hi everyone, Redhead Metal Diva here, Reducing Red, coming at you to start the video documentation of my, hopefully, weight loss journey. I was approved for vertical sleeve gastrectomy on December the 2nd, and my surgery is scheduled for December the 30th, 2013, this year. So really excited, a little bit of nervousness. I don't like general anesthesia. I've had it a couple times and it was awful. But I'm more excited of what could happen after the surgery. My cat Bertrand is who you hear in the background. He's like this big old black jaguar, but then when he meows, he's like, meow. It's pretty funny. Anyways, about me. I'm looking at my notes here. I am 5'4" and a quarter. The quarter is very important, don't leave it off. And I weigh 237 pounds currently. This is pretty much my highest weight. I've gone up and down, but always kind of am coming back here. Whenever I do lose weight, 20, 30, 40 pounds, I always gain it back, whether it's, weeks or months later, and I usually gain back more than what I lost, and that's kind of my life. I've always been larger than everyone else, my age, my height, that sort of thing. All growing up, my friends' parents were always like, who's that older girl? And that older girl was me. No, I'm not older, just larger, and apparently had a little more hormones than everybody else. Gotta love the hormones. So, that being said, here's some sizes statistics. Shoes, just in case it ends up making a difference. I've heard your feet get smaller, but depending on the shoe and the style, I can wear anywhere from a 6.5 to a 9. I know it's humongous. Why is there no standardization? But there's not. Working my way up. Pants, usually a 22, sometimes a 24, sometimes a 20, just depending on the manufacturer, the cut, the style, the stretch. Tops, I wear, I think this is a double extra large, which is pretty standard. I think I have a few triple X's, possibly some extra larges still that I can wear, but that could be because they're old and they're stretched out. I don't like to go shopping very much, so most of my clothes I've had for a very long time, and I just kind of wear the same outfit over and over and over, because I don't like to go shopping. Mostly why I don't want to go shopping is my bra size. Anyone else out there who is, what people say, blessed, I do not find it a blessing. It's hard to have a large chest. I currently am wearing a 36L. Yes, I said L, as in ludicrous, because it's ludicrous. I've always been large-chested. I had boobs when I was 8. One of those lucky girls that just grew up so quick. But when I was 16, I was about 150, 160 pounds, and I wore a 34 F4G. I can't really remember. So hopefully, in this journey, I'll get to 160, and, if there is a God above, my boobs will get smaller. I'm sorry, there was just that whole tangent on my breasts. Oh, you want to see him? That was disgusting. I'm sorry, guys. Anyways, the reason I've chosen to do this surgery is not just for weight loss to, you know, be skinny and wear cute clothes, because I've always been confident in who I am and my body, and I have what I like to say, body dysmorphic disorder, but in the opposite way that people classically present with that disorder, where I see myself as smaller than I am. When I look in the mirror, I see my, you know, 160-pound self back when I was 16, and that little dream world is only shattered when, you know, I have to buy a new pair of pants or a dress for a performance or something. And, you know, it's size 22 after, you know, trying on 8 pairs of pants because I picked up a 12 thinking I could still fit in a 12. When indeed, folks, I cannot fit in a 12. Sidetracked, there's my cat Bertrand again. So, health is why I am doing this surgery mainly. I have inappropriate sinus tachycardia, which is, you know, big long words that basically just mean for no reason or inappropriately, my heart beats extremely fast, even while I'm sleeping. My average heart rate, including sleep for a day, is 134 beats per minute. And most people are around 70 or 80. So as you can see, it's quite high. It prevents me from doing exercise and other strenuous activities because my heart rate could go even higher, and that presents many health dangers. Not to mention I do suffer from anxiety, so that makes my anxiety worse just because the heart rate and hormones going through my body, whatever. You know, I have had a lot of panic attacks earlier this year, luckily not in the past couple of months, so that's really good. What else? I have hypertension, I have high cholesterol, I have an autoimmune disorder called Sjogren's, S-J-O-G-R-E-N, lovely word. It's basically kind of a cousin to lupus, but it affects my joints and all of my water-producing organs and membranes. You know, some people with severe forms need organ transplants, but mostly I just have a lot of joint pain, and you know, my eyes are really dry. It causes eye problems. I have to get a new, you know, glasses prescription every 4 to 6 months because my eyes change so often. Not that weight loss is necessarily going to do anything for that, but also my fasting sugars. Last time I had my blood work taken, like a month and a half ago, my fasting blood sugars were 99. The cutoff for a normal blood sugar is 100 when fasting. So creeping up there to the diabetes, and I don't want to go there. Never wanted to go there. It's not in my family, thank goodness, but obviously I was getting pretty close there because of my weight. So I'm hoping that for sure my hypertension goes away. I've only had hypertension for 2 or 3 years now. Normally I'm in the like 90/70 or 80 range, and lately I've been in the 130/high 80s range, which for me is really high, but you know, is almost normal for everyone else. Hopefully my cholesterol will go down. That seems pretty likely that it will. My sugars will go down, which has to happen since I really can't have sugar on the post-op diet. That should really be a sure bet. Also, I'm hoping hoping, and praying that it will help my inappropriate sinus tachycardia. I've read a lot of studies and seen a lot of videos where people talk about their heart rate going down. So it's kind of a long shot, but hey, a girl can hope, right? Don't take that away from me. Goals! Besides the lessening of a lot of my health problems, I am hoping to be in a quote-unquote normal BMI, which I think is a flawed system, if I didn't say that already, but, you know, it's kind of just a marker. It's a tool, it's a reading that the health industry uses. I feel like this video is going forever, guys. Anyways, so I will be tracking my journey, even though I'm a very private person, because I want to pay it forward. All the videos I watched of all the people were very inspiring, very encouraging, very informative. I'm a researcher, you know, to death, OCD researcher. So, you know, on top of everything else, the videos really helped. And I want to be a person who can help others who might be in my position now or in the future to come. So I will make a video after my next post-op with my surgeon, and possibly post-op. I'm getting excited ahead of myself. Just want it to be over with. Pre-op. My next pre-op with my surgeon. I'll make a video, let you guys know kind of what's going on. I am on a diet right now to reduce the size of my liver. Just really trying to stay away from carbohydrates so I can lose some weight and make my liver smaller so that the laparoscopic surgery is easier for the surgeons, and hopefully that relates to easier recovery for me, as well as, you know, a little kickstart for my weight loss journey. Sorry guys, having problems speaking. So I'll make a video after my pre-op appointment, possibly one pre-op in the hospital and post-op, since I will have nothing else to do except lay there and try to drink water and walk to prevent the shoulder pain that can come with having your abdomen insufflated with CO2. Yeah, so thank you guys for watching. Hopefully this will be a weekly thing and I can share my progress with you, and you can ask any questions or do whatever, or don't, because I'm not a very social person. I can be, but I'm just, my nature is to tend not to be, so if you don't want to talk to me, that's fine. My feelings will not be hurt, but if you do want to talk to me, I'll try to help as much as I can. And I think that's it. I've never done this. Can you tell? No. Okay, so thanks for watching.